Spoiler. Good afternoon, and welcome to another edition of the COVID313 Community Town Hall for Families and Youth. This is a sobering day for us. It's beautiful outside. More of us are staying with our families, staying focused, staying healthy, masking up, keeping our social distance here in the city of Detroit. However, the reality is that yesterday, our nation literally had a brand new Pearl Harbor. And we're almost at this every single day. Families, our nation is witnessing a level of devastation, illness, sickness, and death that we've never seen before. And while we come to you every single week to bring support, love, and information, we also want to make sure that we are acknowledging and embracing all of you who, like us, have been adversely impacted by this pandemic. And so we really have a dynamic program for us today. We're going to talk about things that help us not be healthy, such as lead in our water. But we're going to talk about what you can do in terms of getting testing. Where do you go? What do you need to know if you test positive? So we're going to have our health officials back with us. We're also going to talk education, parents. We know that you are trying to juggle one of the most incredibly difficult times in your life, which is to be a parent, and there's no book for that, during COVID, and work and support your family, work and support your children's learning. We're also going to have the opportunity to hear our parent voices. So families, we're going to do what we always do, which is to love on you, support you, bring resources and trusted sources to inform us. But we would be remiss if we don't just say, we have to pause. We have to pause to breathe. We have to pause to acknowledge the pain, the uncertainty, indeed the fears that we know are out there. And so we want to welcome you to do two things with us. In our last program, I shared photographs of members of my family, specifically my husband's loss of his baby sister and our brother-in-law to COVID, and a cousin. We're asking you to do the exact same thing. If you have photographs of family members that were not, unfortunately, part of that wonderful display at Belle Isle that Rochelle Riley and our mayor made happen at Belle Isle, send your photographs to us. We want to be a witness to the pain and also our ability to be resilient through this. And being resilient also means that sometimes we just have to hit pause. So I want to welcome you for just 10 seconds to hit pause and let us meditate on the beauty, the joy, and even the sadness that we feel for those that we have lost. If you would, just for 10 minutes, let's stop. And you must be able to tell that when I said 10 seconds, what came out of my mouth the second time was 10 minutes. And that's probably my own spirit saying to Meta Lily, you need to pause for at least 10 minutes, sometimes more, to look at and think about the grief that all of us are carrying. But I'm going to shift gears because there's something special about Detroit, and there's something special about all of us, and that no matter what kicks us, we know how to pull it together and to continue to move forward and to be powerful. So I am a witness and joyful to let you know that my name is Jametta Lilly, and I'm blessed to serve as the CEO of the Detroit Parent Network. I am honored to be a part of this magnificent coalition. I am a wife, a mother, a nana, and I am one of those women standing with our governor, one of those women from Michigan. And joining me in this really dynamic program that we have today, always is my co-moderator, Christine Bell, who too is a mom and struggling, and we're all trying to figure it out and be prayerful and peaceful and powerful all at the same time. So let's join in the madness of the moment and feel and love on each other. I'm kicking it to you, Christine.
Thanks, Jametta. And that 10 seconds really felt like a very long time. It's almost surprising when we pause, just even for 10 seconds, how that can rejuvenate us and help us to move forward during really what has been, and I feel like I've said this over and over and over again in the last 10 months, what a difficult time this is, whether you've lost people or you're trying to navigate homeschooling or schooling your kids at home, or trying to figure out what Christmas or Hanukkah or whatever holiday you celebrate during this time, how you're going to do that and it still feel the way that we need it to feel. These are difficult times, but together we are going to make it through these times, and the only way we're going to make it through these times is together. So I'm Christine Bell, and as Jametta said, I am a mom of 3 really amazing children. And I'm also very humble to serve as the Executive Director of Urban Neighborhood Initiatives. And I am also a very proud member of this coalition. We're going to translate the town hall into Spanish and ASL today. So we really want to give folks some time to get on the right line and get comfortable. And so we're going to have Cindy come on, and she is going to share the phone number for Spanish translation. Cindy?
Si necesita traducción en español, por favor, hable al 313-626-7440. 626-7440. Gracias.
Thank you, Cindy. And then I believe, is it Katie? Katie is going to share the ASL instructions. Katie? Thank you, Katie. We want you to stay with us for the next 60 minutes so you can stay informed and powerful, and hopefully by doing that, it helps us, helps you and us to get through these really difficult times. Today, we're going to talk about the most up-to-date information that we have about COVID. So we'll hear from our health department and a few other folks. And then we also are going to have a really interesting conversation about lead and water and lead in water and what's being done around that from some very powerful speakers. My son is in the background saying he would really like to hear about that. So maybe I'll get off my headphones for that one. And then we are also gonna hear from our charter schools about what is happening right now and what's to come in January. This is really a time for you to be able to ask your questions and share your comments with the experts that we have brought to you today. You can do that by posting questions or comments in the Facebook chat, or you can text your questions to 313-288-2082. Again, that number is 313-288-2082. And Brooke and Lindsay are moderating those chats, and so they are waiting for you to send those questions and comments to them. We will also have a question and answer, a time for question and answers after each segment. So please, keep your questions and your comments coming. If they can't be answered, if your question can't be answered today, we are committed to getting you the answers, and we'll do that by early next week. And those will be posted on Detroit Public Television's Facebook page, as well as their website, onedetroitpbs.org. I have a few instructions for our expert guests today. Please remember to speak slowly for our translators. They want to make sure that they're translating the information that you're giving correctly. So please just talk a little bit slower than I'm talking right now. Also, please turn off your camera when you're not speaking to ensure that our ASL interpreter can be seen. And lastly, mute yourself when you're not speaking. Terry Whitfield is our timekeeper, so keep your eye on the chat. He will chat you your remaining time. And if you go over your time, Jametta or I will pop onto the screen and gently remind you to wrap it up. So today we're going to get right to it. So Jametta, will you please introduce our first guest?
Sure, happy to do that. So a really critical issue that we know has beleaguered the city of Detroit and indeed urban areas all across this country is the issue of lead, whether it's lead in our housing, throughout the environment, in the land, and in our water. And it's really important for us to understand that all of these factors are the things that keep us unhealthy. And when we are unhealthy, we are not able, our bodies don't have what's needed to fight these things, such as a pandemic. So it's important always that we're focused on our health as we think about where we want to go through this pandemic and beyond. And to help us to think about that and laser in on information as well as social action, we're really so pleased to be able to have speakers today with us to talk about lead that is in our water. And I want to have you join me in inviting Jen Reed, who is going to be the moderator for a discussion, and she's being joined by her colleagues, Rita Lauch Caruso, as well as Aaron Balanzo. And if I have mispronounced anyone's name, please forgive me and make that correction. But we're really pleased to have you with us. Audience, we hope that you will listen and know there's an opportunity for you to get your questions in. You can again do that in the chat or text us at 313-288-2082. And with that, Jen, please begin with us and welcome.
Thank you, Jametta. I appreciate that welcome. So as you mentioned, I'm Jen Reed. I direct the Water Center at the University of Michigan. I think folks have all heard about having lead in our drinking water recently, and we're here to discuss whether you should be concerned, how to address your family's risk, and what local communities are doing about it in the area. As you mentioned, I have some folks joining me today who are the real experts in this. Elin Batanzo with Safe Water Engineering brings 20 years experience as an engineer working on drinking water science, engineering, and policy issues. Dr. Rita Lauch Caruso is a toxicologist at the University of Michigan's School of Public Health, and she's an expert in the ways that chemicals impact mothers and babies in the womb. And finally, Laura Mikulski, Ferndale City Councilor, an advocate for environmental health, and the mother of a young child. So I wanted to just welcome all of my fellow panelists, and I guess note that we're all moms. So we all bring to this conversation that concern we have as parents too. And I'll just encourage folks to ask those questions that they have for panelists, and our intention is to help answer those and make those responses available. I have some questions prepared that we think will take about 15 minutes or so, and then we'll have time for those questions from our audience. So my first question to kick it off is for Elin. Elin, can you tell us why is there lead in our water?
Well, lead gets into water when there's lead in the plumbing. And unfortunately, a lot of our plumbing contains lead. We can group lead in plumbing into 3 different categories: lead service lines, lead in piping material, and lead in fixtures. First, many older homes here in Michigan, especially Southeast Michigan, have lead service lines. These are solid lead pipes that bring water from the street to the house, especially in homes built before 1950, and they weren't banned until 1988. Lead service lines are the largest source of lead in water. Second, we have lead in piping material, lead in galvanized iron pipes, and in lead solder that connects older copper pipes. Then finally, we have brass fittings and faucets that can contain high levels of lead, especially in materials that were purchased before 2014. So when water flows through these materials, the water picks up lead along the way. And this is how lead can end up in a glass of water.
Thank you, Elin. And we have some resources that we're hoping can be sent out in the chat to be shared that go into a little bit more detail on that, that will help folks. And maybe you might have some questions about those along the way. But I'm going to ask Rita now. So we have lead in my drinking water. Why should I care about that?
We should care that there's lead in our drinking water because whenever we drink water that has lead in it, some of that lead is going to get absorbed into our bodies. And this is particularly true for very young children who will absorb much more lead and will absorb more efficiently than someone like me, an adult. Health professionals at the United States and across the world have agreed that there is no safe amount of lead exposure for us. Once lead gets into our bodies, even small amounts of lead can damage vulnerable organs. And this is particularly a concern for the developing brain of a young child, particularly the developing brain of an unborn fetus. Even adults, we face health risks from drinking lead-contaminated water also, although we won't absorb it as quickly and efficiently as a young child. When we get lead into our bodies, it can cause health problems to our heart and our blood circulation system. And one of the most serious of those concerns is an elevation of blood pressure. So yes, we should be concerned about lead in our drinking water. Thanks for having me, by the way.
Thanks, Rita. Well, so that does raise some real concerns, and I'm sure people are now asking the question, how will I know if there's lead in my water? Elin, can you help us with that question?
So when there's lead in your plumbing, there's a risk of lead in the water. So that means the most important step is to find out how much lead is in your plumbing. So generally speaking, the older the home, the more lead there is in the plumbing, unless that plumbing has been replaced. Now, if the lead levels measured in your community are high, your water system will notify you. If your community measures lead over 15 parts per billion, we call that a lead action level exceedance. If that happens, your water system is required to issue a public advisory and send you information about lead in water directly to your home. Now, on the other hand, if your community doesn't have a lead action level exceedance, you may still have lead in your water, especially if you have a lead service line at your home. But it means you might have to do some more investigating. So the most important thing you can do is find out if you have a lead service line. So we're posting some links in the chat that have some resources to help you find out how to go into your basement to look at the pipe that comes into your home to see if it's lead. You can also call your water system to ask them if they know if you have a lead service line, because some of that lead line might be buried and you can't see it. You can also ask your water system to collect lead samples at your own home. And you can check the Michigan Department of Environment, Great Lakes and Energy website, because they are publishing lead data for communities doing lead sampling across the state. And I think that link might get posted in the chat, I hope. So even if the lead results in your community are low, you could still have lead in your water if you have lead in your plumbing.
Okay, Elin, you mentioned a 15 parts per billion level. Is that lead, is that level safe?
15 parts per billion is not a health safety standard. It is a regulatory action level. That means that 15 parts per billion is the concentration of lead in drinking water at which municipalities are required to take action to reduce the concentration of lead.
Right, our goal is to get it down to zero, right? For health purposes.
Absolutely. We, especially to protect the young, we do not want to have any known exposure to lead.
So then I'm sure people are asking, how can I protect my family? What are your suggestions for that, Rita?
Sorry. I think Elin was going to actually start with talking about some hard solutions on changing some of the plumbing in your house. You want to start, Elin?
Sure. So first step would be to investigate your household plumbing to identify and replace sources of lead in drinking water where you're able. If you have a lead service line, you would have to be working with your water system to get that replaced. But if you have a lead service line, until you get that removed, you can install a filter and then use that for all of your drinking and cooking water until you get that lead service line replaced. But as I said before, there are other sources of lead. So even if your home does not have a lead service line, you may still want to consider adding a water filter that removes lead. And we do have some resources and information on how to identify a filter that reduces lead from water. So if you know or you suspect that your tap water has lead in it, then you should run it through that filter before you drink the water, cook with that water, make any beverages, or if you brush your teeth with the water. You'd use filtered water anytime you're drinking it. You should not swallow the water while showering or washing your face.
So a few other behavioral things that you can do. It's important that whenever you draw water for drinking or cooking or toothbrushing, that you only draw water that you will swallow or you intend to swallow from the cold water tap. Hot water can contain elevated levels of lead in it compared to the cold water tap, and that's because of the hot water heaters. So only draw water from cold water tap when you plan to consume that water. Also, if you haven't run the water through that tap for a while, for several hours or overnight, it's a very good idea to run the water for a little bit through it. In fact, one of the best things you can do is flush the toilet when you get up in the morning. Go to the bathroom, flush the toilet, because that will pull water through the pipes. And at the sink, wash your hands maybe first, wash your face first. This helps to bring a fresher load of water to the tap before you draw any water for drinking. In addition, if you are preparing infant formula from powder, it's very important that you only use water that is bottled water or has been filtered, because infants are so good at picking up every bit of, or picking up and absorbing lead that they swallow in any kind of a beverage. So you do not want to prepare infant formula, powdered infant formula, with water from the tap.
Thank you, Rita and Elin. Those were some really great suggestions. And as was mentioned throughout, we've chatted some links to greater detail so that folks can follow up and explore that a little bit more. I want to turn now to something happening in one of our local communities and ask Laura about the lead action level exceedance in Ferndale. What's happening in the city of Ferndale to reach families like yours?
Well, hey, thanks for having me. First of all, we're doing multiple things. After the action level exceedance community notification we mailed out, we did several other things. We contacted the county and made sure that free water filters were distributed to our most vulnerable individuals within the community. Additionally, we put out an FAQ on our website, and we had a conversation within the community about the issue at our city council meeting, just to elevate it a little bit. Additionally, we started mailing out a public education piece to help residents understand what all of this means. We're also implementing process improvements. So since this is relatively new for most cities, we've been working closely with Eagle to help ensure that we and other communities meet the mark for communication in the future. The project has actually been developed into an internal project management charter, which again is just elevating the importance of this internally so that we have it scripted out for the next year and we meet all the requirements that are known and understood going forward.
And is there an opportunity for Ferndale to share what it's learned with other communities, maybe through that Environment, Great Lakes and Energy connection you mentioned?
Absolutely.
Great. So Laura, as a mom, what would you tell moms, parents listening about this situation we're in?
You know, as a mom, and my daughter is just now a year old, I would say always err on the side of caution. If you are living in an older city, which a lot of us in southeastern Michigan are, err on the side of caution. Make the assumption that lead is somewhere within your service line system, maybe in your house. Take advantage of any of the programs that are out there. So any free water testing. As I had mentioned, we have free filters for our vulnerable populations within Ferndale. Make sure that it's an NSF 53 filter. Make sure that you are doing all the good things that we've already talked about to protect your family. And know that going forward, transparency is going to be crucial. We want people to know that the risk is there, even if there is no lead action level exceedance.
Thank you, Laura. I really appreciate that. There, you've got those dual hats on as counselor and parent, and appreciate that perspective that you're bringing here. We have chance now. I think I just want to check in with Christine and Jametta to have some questions from the audience. I think maybe 5 minutes or so. As if there's a way for us to hear those questions, we can field them.
Sure, that would be great. Christine, do we have any questions that have come in so far from the chat or either our text message?
Yeah, there's been a few. So, and I'm trying to see who, I think it was Rita. You referenced because of the hot water heater, that's why you don't want to run the you don't want to use the hot water. Could you expand on how the hot water heater is, creates more lead in the water?
Sure, and I might invite Elin also to chime in because she's the engineer in the crew. But it's that the hot water heater has the water standing in it for a while, and it helps to it encourages precipitation and collection of these precipitates. And it's my understanding that that's the main cause, and that if you flush your hot water heater regularly, which I don't know anyone who does, but if you flush your hot water heater regularly, you can avoid that. But probably the best advice is you simply should not be using water from the hot water tap for beverages or food preparation.
And
Elin?
I'll just chime in a little bit there. Part of it's just the temperature itself. The hot water will more easily dissolve that lead and pull it out of the plumbing when it's present. So it builds up exactly like Rita said in sediment, and that can be carried out of the hot water tank. But that hot water, if it's flowing through the tap, is going to pick up even more lead as it travels to the tap. So it seems sometimes counterintuitive. Like if you want to boil a big pot of water for pasta, why don't I start with hot water? But you might be increasing your lead exposure when you do that. So start that pot with cold water and then boil it.
In fact, boiling water is a very bad idea with lead contaminated water, because you'll actually end up concentrating the lead, because you're going to boil off the water and leave the lead in the pot.
Right. So then you would filter it first, then boil it for pasta.
I think you're on mute, Christine.
Sorry, I muted myself on my phone and on the camera. So I apologize for that. So will our bodies absorb lead when we shower or brush our teeth? Not sure who's best to answer that.
I can handle that. And the answer is that lead that is dissolved in water is in a form that's not very readily absorbed through the skin. So contact on the skin, absorption of lead from water through the skin is not considered a big concern. Similarly, although you can get this vaporization and volatilization during a shower, and you get the water vapor then, that's also not considered a big concern for exposure. The lead tends not to evaporate into that phase. No.
Great.
Oh, I hope that was, I thought
Thank
someone
you.
was debating it.
No, there's a little background noise. I
That's
am a
okay.
parent that has a child and actually he wanted to hear this segment. He sat down and was watching it. And so as I'm asking questions, he's giving me his thoughts on what might be happening. He's a young budding scientist at 6 years old.
Great.
Are there resources available for everyone? Are the resources that we're sharing available for everyone, including the undocumented community?
I think I can take that. This is Jen. So those resources we're sharing are freely available on our website at this point. Anyone who has access to the internet can access them. And then we are working on ways to provide them through other means so that folks who don't have ready access to the internet can receive them.
Great, thank you. And the last two I think are really important questions. Do you know how pervasive lead pipes are in Detroit? Will the city help homeowners and landlords replace lead pipes?
I'll take that one. So in the city of Detroit, the Detroit Water and Sewerage Department estimates that there are about 80,000 lead service lines in the city of Detroit. So that's the largest number in the entire state of Michigan. So there is a lot of lead service lines. They are predominantly in homes that were built before 1950. Under the Michigan Lead and Copper Rule, Detroit should be sending written notice to homes that they think have lead service lines. So hopefully residents are getting some information about that. They should ask the water department if they haven't received that notification. And then under the Michigan Lead and Copper Rule, there is a requirement to remove all the lead service lines in the entire state. We're the only state that has this requirement. And they all have to be out within 20 years. We have until 2041 to get them out. It's a long time. But the way Detroit is approaching lead service line replacement is they are, every time they're doing water main work, sewer work, they are taking the lead service lines out as they go. Mm-hmm. So if anybody is living on one of those projects, their lead service line will come out. That will be at city expense. The resident does not have to pay for that. If somebody needs to be on a different schedule, they should call the water department to find out about other opportunities.
Thank you, and we will bring more information back to the coalition. But there are programs in the city of Detroit that will help homeowners and landlords around lead in their homes. So we'll bring more information regarding that next week, or we will post it on Detroit Detroit Public Television's website. Last question, how much do filters cost that remove lead? Are there subsidies available for them?
Should I take that one? I think I will. So the filters that remove lead, they can come in different formats. Probably the most common ones are the pitcher style filters and faucet mount filters. So you want to kind of look at which one works best for your lifestyle. And if you go to a big box store to buy one of those filters, it probably costs about $30 for probably a 2 to 3 month supply of filtration. So, buying it right off the shelf. As Laura talked about earlier, there are some programs for reduced cost filters. I'm not sure what the current extent of those programs in the city of Detroit are. Ferndale has access to that right now because of lead action level exceedance. So there's There are some opportunities out there, but a lot of it depends on exactly where you live.
So it sounds like we have to collect a little more information for Detroiters to see what is available related to the filters. Thank you so much. That's all the questions that we have.
Thank you so much. And consistent with what we try to do is when we have information, for those of you that may have some follow-up questions, we'd love for you to still put those in the chat. And then we're happy to share that with our guests, because we know that certainly the city of Detroit has the largest, not only lead issues, but prevalence. And it's important, families, that we understand that all those issues that we have to cope with all the time, whether it's asthma, whether it's lead, whether it's other chronic conditions, those are things that we cannot put off during COVID, because we need to stay as healthy as possible. And speaking of health, we're going to continue this focus on health by going to, as we always do, to our public health officials and those in the medical field. And so pleased to be able to welcome back to the program, Japari Paul, who is a nurse and is part of the wonderful team at the Detroit Health Department that is trying to help us stay on top of what really is a sobering reality that we have hit in the entire nation, with that number of 3,000 human beings, souls, families, individuals that we love that have passed. And so, Japari, welcome back. And if you would, if you could come on screen, because we'd love to be able to see you and your dynamic and hear your dynamic voice. If you could begin with us a little bit about, where can people go to get tested? What do we need to know about testing? And then could you tell us where we can go and some things we need to be apprised of? Welcome back, Japari.
Thank you. It's good to be back. It's nice to be able to speak with everybody again. I hope everyone is doing well and staying safe and healthy. So the first question you asked, Ms. Jametta, regarding where we can go to get tested or information for testing would be on the michigan.gov website. And I do have a slide here that will walk anybody that is interested through the process of how to request a test or how to look up testing sites in our state, actually. So if you could slide to take us to the next couple slides here.
Japari, if I may, why don't we just back up? I recall when I look at your slides, you're starting this right here. Give us some idea. We've seen these national statistics, which are pretty frightening. Tell us the reality. What's happening right here in the state of Michigan and in the city of Detroit?
Yes, absolutely. So we are still seeing the high numbers, and we're coming into the numbers that that are being calculated from the Thanksgiving holidays. Currently in Detroit, we have 22,505 confirmed cases, and then a total of 1,627 confirmed deaths. The map on the right-hand side of the screen, the map of the city, shows the zip codes that are seeing higher numbers. So you can see 48228 or 48210. Those are areas that there is a higher number of tests coming back positive. So if you are in those areas and anywhere, please continue to be cautious, take extra cautious, because the number, it's spreading really fast and it's spreading really well during these cold months. And then in the state of Michigan, we are seeing that it's at 415,200 confirmed cases, and then a total of 10,213 confirmed deaths. Now on that map at the bottom where we see our Michigan mitten, it kind of shows the different counties and areas that they're collecting data from. So I do want to highlight there that the positivity rate, which is a rate that shows the number of positive cases coming back when they do a bunch of tests, is a little bit lower in Detroit compared to Macomb, Oakland, and Wayne counties. We need to continue to be the leaders in this coronavirus and be the example and continue to keep this number low and bring it down even more. So I want to encourage everyone to take the steps that we need to take. I believe in the next slide, we've been allowed to see now what hospital capacities are looking like. The Department of Health and Human Services provides data now that shows how much space or how much availability is left in hospitals around the entire country. I highlighted Michigan here, and it shows that Michigan is currently at 80% capacity. And this means that we have a total number of 20% beds available in the state. And this is not just coronavirus or COVID-19 patients being taken care of in the hospitals. This is patients with all sorts of illnesses that need the care, that need the help, and we don't want to overwhelm our healthcare system. So in the next slide, we shall discuss where it's spreading in our city. We're seeing workplaces all over the place getting exposures and people testing positive. We're seeing long-term care facilities, social gatherings, retail businesses, shelters, bars, and restaurants as the prime areas recently having high numbers. And this is just a reminder that as well as when you hang out with people or interact with people, you need to maintain that physical distance and limit your time. Exposures are happening in in close family homes and households as well. In the next slide, I do want to remind us all that we are still in the Pause to Save Lives order from the MDHHS from the state of Michigan. And this is going to go on until the 20th of this month. This infographic is available for anyone on the Detroit website, www.detroitmi.gov/coronavirus, or on the MDHHS website. And we'll go through that website once more here. Next slide, please. Regarding testing, as Mr. Mehta had talked about, there is a hub where we collect or have all the testing locations that are available to residents in our state. The website is www.michigan.gov/coronavirus test. You can also call the number 888-535-6136 and press the number 1. In the next slide here, I will take you through what the website looks like. When you click on the michigan.gov website, the first side on the left will show you a welcome screen, and you'll see it says find a test site. When you click that button, it will open a new window. And in that window, you'll be given the option to add your city or your zip code, and then you click search. Next slide, please. And when you search, on the left panel, you will see all the different sites that are located within that zip code or that city that you put. And these sites will give you specific details, even details like if you're wanting to take a saliva test, they'll tell you if they're doing saliva tests there for COVID-19. They'll tell you the available appointments or the phone number to call, and they'll also give you the ratings that people have put regarding these testing sites. So that's cool. The next slide, please. Also, I just want to let everyone know that the Joseph Walker Williams Community Center is available for residents within the Wayne, Oakland, and Macomb counties. It is at 8431 Rosa Parks Boulevard in Detroit. And it's by appointment only, so please call the number 313-230-0505. They do require identification. Okay. Next slide, please.
And if I may, just before we make this really important shift, yes. I just want to remind the community that we know that vaccines are coming but there's a lot of myths around that, Japari, aren't there? As well as a lack of certainty. And so hoping that if you could, about in the next 5 minutes, give an overview of what we need to know about the vaccines. And also, as we think about the holidays, including Hanukkah, and happy Hanukkah to those today, as we think about the holiday period that we're going into. If you would, please.
Of course.
Mm.
So in regards to the COVID-19 vaccine is going to be available possibly within the next couple weeks. The we are waiting on the FDA to give it emergency use authorization, and after that we will be able to administer the vaccine. I do want you all to know that the vaccine would be administered in various phases, and it'll be in 3 different phases. The first phase is phase 1. And in the next slide, we can see that phase 1 is actually broken down into 3 other subgroups. Phase 1 is when we have potentially a limited amount of vaccines available. So people like healthcare providers and residents of nursing home facilities will be the first to get those vaccines. In phase 1B, we'll have the essential workers getting the vaccine, and in phase 1C, people with chronic conditions or critical conditions that might be at higher risk, or people that are above the age of 65 will be in that group. Finally, phase 2, when we enter that, is when the vaccine is available for the general public. And then lastly, phase 3 is a maintenance thing, and that will be when the vaccine will be supplied and provided in routine vaccination visits to the public as well. So if you can go to the next couple of slides, I can discuss, and we already discussed this, but I will briefly go over the holidays. Next 2 more slides, I believe. Yes. So as Jametta said, happy Hanukkah. Today is the first day, and I do want to remind you all that the CDC, MDHHS, as well as the Detroit Health Department recommend that you avoid large gatherings or gatherings in general and celebrate virtually. If you do gather, no more than 2 households and 10 people at a max. In the next slide here, just briefly giving you some tips. If you are going to have a gathering at your home, I advise you to set some ground rules. Let people know that you're going to be having everyone wear masks, or if you are going to a gathering, let people know that you will be wearing the masks and that's how it should be. Advice to have single serve items, and then be aware of cleaning frequently used surfaces regularly. In the next slide here, finally, to discuss travel, because people might still want to travel. Do your research, look places up to make sure that it is safe to travel there, and if they have lockdowns or restrictions, get that research done. But then we do ask that if you are going to travel, consider getting tested before you travel and after you travel. And you can call the health department if you have more questions, and we can give you some advice and recommendations with that.
Japari, thank you so very much for every time that you join us, as the department does and our other health partners is being thorough. And we want to encourage families that if you would like more of the information, Japari has done a walkthrough with you. These slides are also available. And if we could, Cindy, let's see if we can put these slides in the chat so that anybody wanting to get this information quickly might be able to do so. Again, thank you so much for that. We're going to continue our focus on health and staying healthy all the time and through this pandemic. And so one of the partners that is really so critical is to have primary care always with us, because there is COVID, and then there is simply improving the health and wellness and well-being of Detroiters all the time. And we're really so delighted that Chaz Center has always been doing that as a federally qualified health clinic, making making such a difference throughout the city of Detroit. And we're really pleased to have Dr. Richard Bryce to join us. Dr. Bryce is also the Chief Medical Officer at the Chaz Center. Welcome. We are delighted to have you and to hear your recommendations to us as we think about how we're handling COVID, the testing necessary, and of course, the question on the table, vaccines. Dr. Bryce.
Excellent. Well, thank you so much, Jametta, for introducing me. And thanks so much for having me today. Obviously, the health department has been pretty incredible over the last, I guess 9 months since this has all started. And so we've followed a lot of their leads, and I thought the previous presentation was excellent. I know from us at Chaz, obviously there's a lot that's happening right now. We're still continuing to do drive-up testing, which is available Monday, Wednesday, and Friday. And we'll continue to do that throughout the winter. And in fact, it's been drive-up right now, but due to the colder temperatures, I think we're going to actually be transitioning over into a kind of like a trailer center so that, people don't necessarily need to be outside in the cold. So that's exciting. As well, that was just mentioned, the vaccine is coming, and we actually probably have access in the very near future to start to vaccinate some of the healthcare workers here at Chaz. And we'll be a hub for some of the other federally qualified health centers in the region to make sure that we can get people to get vaccinated. And so that's one step. And then the other thing that's really important for us is, I know there's a lot of information that's out there about the vaccine, and there's some misinformation even about coronavirus and COVID-19 as well as the vaccine. And so I think what we're trying to do is just encourage people to, do your best you can to get, good information that's out there. Of course, we're sharing that information as well. And, the vaccine is the only way that it works is that if we all participate. I can tell you from my standpoint of what we're seeing so far in the Pfizer vaccine, which is the first one to have emergency approval, it seems to be a quite safe vaccine. It also seems to be effective, but I think the safety profile is a huge benefit going forward, knowing that that we can all participate this. And the idea is for us to really encourage our patients, our community to get involved so that we can really start to make a dent, especially in these growing cases of the coronavirus. And so with that said, though, I would say even with the vaccine, we're still in a phase of we still need to be washing our hands, using social distancing, as well as wearing masks. We know that makes a huge difference. And so we're continuing to encourage that for our community and throughout the community in the Detroit region. And so we are in a difficult time related to COVID-19, but hopefully we're optimistic about the future. And I would love to answer any questions if anyone has any.
Great, thank you. We are going to open up to the audience. If I could just kind of pull back for a moment, because not everyone really may know about the great work that Chaz Center has done. But in particular, when we think about COVID, we know it has disproportionately devastated African-American, Latinx, and Native American communities. And Chaz is a major health provider in Southwest Detroit, where we have a significant number of both Hispanic as well as other African Americans and other groups. Could you talk a little bit about what you've seen and maybe some of the ways that Chaz has engaged the community and been responsive to some of those dynamics? And have you seen perhaps even a decrease in some of the COVID cases that you may have been engaged with?
Well, I think one of the challenges that has happened over, especially if we look over the last 9 months, I think the health department in the city of Detroit did an incredible job very early on, much earlier compared to other cities, of establishing easy ways to get free testing. And what we found especially was, and that was obviously at the fairgrounds, which was an incredible program and something to be proud of. Challenge though for us is, in our community, there's obviously multiple patients that are bilingual, and in fact, maybe only they speak other languages, not English. So if you add that onto the transportation to get up to 8 Mile and Woodward, that seemed to be, sometimes that would inhibit people from the ability to get access testing. And so that was kind of where Chaz decided, and this is actually the encouragement of the city was, hey, Chaz, we really can use you to connect with the community that you serve. And that was why we started doing testing. And of course, that testing is all free. So it doesn't matter if you have insurance or you don't have insurance. And we think this is something that's really, really important to kind of start the process, especially for the patients that we serve in our community. And So that's one area I think that we've been able to kind of perfect of how do we do the testing? What's the best way to do the testing? How do we inform the people in our community that the testing is available? And so that's one part. And then the secondary part is when you're doing testing, the communication is really important. So communicating with people, whether they have a negative test or a positive test, and then of course explaining if you do have a positive test, what does that mean? Because unfortunately, and I don't think this is unique just to Detroit, but when many of the patients that we serve, they live with multiple people in their home. And so now when one person's positive, unfortunately, that's an easy transmission to others in the family. And so I think that education is really, really important. We really pride in making sure that we're educating the community. And I think that the last thing I would comment is it's going to be the same thing with the vaccine when we come here, is that, we are somebody that we feel we communicate well with our community, and we want to make sure that they have all the education so that they can make the right choice. There's no pressure for somebody to take the vaccine. But we also know that unfortunately our community has been devastated, especially when we're talking about those that may be African American, Latinx, Native American, as you mentioned. And so we find that this is a solution to really decrease those health disparities that our patient population has faced. And so we know we're excited for the approval to come soon, but we know we are going to have a lot of work to convince those by giving them good education about what the vaccine means, what the side effects possibly could mean, and then obviously what the benefits are for the patient, their families, and the community. And so I think for Chaz, we are definitely somebody that we want to understand the pulse of who we serve, and we're going to continue to do that and do the best that we can to give the best honest education that we can to our patients.
Great. And before we transition to Christine, if I may, I just want to take a personal privilege and that I'm honored to be a part of Governor Whitmer's Racial Disparities Task Force. And if there's anything that we know, the messenger matters.
Yep.
And so when we think about vaccine hesitancy and what's been the lived experiences of Black and Hispanic people in this country and Native Americans in this country, people like to suggest that somehow that's paranoia. It's not paranoia. It's based upon lived historical and current experiences. Could you share briefly, though, if you think about it, if you were to say, what do you think are some elements that you're going to try to educate folks in your community around, such as did the vaccines have Latinx people as part of the test group? Are those the kinds of things perhaps that you're going to share to help people say, yes, this is potentially safe for you too?
Yeah, well, I think it's just trying to share good information. I think I think one of the things that we have been prided ourselves on here at Chaz for 50 years, because this is our 50th anniversary, is really being the voice for our community. And so I think what that means is that trust that we have with the community is so important to us. It doesn't matter who you are, what is the color of your skin, where you were born, your immigration status, that all that information is that is what makes us, I think, successful, is just continuing to support our community and to build that trust. So when it comes to explaining things like the vaccine, which can be very complex, and unfortunately there can be a lot of misinformation. And I also would say that I can understand why there is mistrust in a community like here in Southwest Detroit to try a vaccine. And so we have a lot of work ahead to try to change those things, give the information that is there that we know, and not try to sugarcoat it either, because I think that's a way to continue to build that trust. And so there are side effects that come with the vaccine. Now, it seems like the side effects that we understand so far are very similar to what a flu shot would be. I can tell you, though, and I also think this has been something that's been incredible with the Chaz community, is that this year, we already at this point, December 10th, we are already given as many flu shots this year as we did in all of last year, which we were giving all the way till the end of March. And so that's an increase of 37% of our patient population. So I think one of the things that's starting to happen is that when we're giving the flu shot, we're starting to share some of the information that we understand about the coronavirus vaccine. And then part of that as well is that we have to go to the people, right? I think being here at Chaz is good. It's a friendly place. It's a warm place to come. But specifically with the flu shot, we've been extending hours here at CHAS so people can come in to get the flu shot. We've also been doing some community outreach and some community flu shot clinics, especially at some of the high schools in the area. And my anticipation is we will be doing the same thing with the COVID vaccine when we are able to.
Great, thank you. And I'm also excited about the upcoming partnership with Wayne Health and CHAS working together, and with United Neighborhood Initiative. It's all about us bringing all our resources together to love and support on our community. And speaking of uni, Christine, do we have some additional questions for Dr. Bryce? And you're on mute.
We do. Yep,
Okay.
we do. And also for the health department. So if Japari could come back on, that would be wonderful. So are there certain parts of the city where you're not seeing enough people getting tested?
Yeah, maybe Japari can answer that better than myself.
Well, yeah, so in general, we are seeing not as many tests done in certain zip codes, especially in the zip codes within the Southwest Detroit area. Which ones come to mind? 210, 209. Even though we're getting high numbers of positive tests, that still shows us that there's not enough people coming out and getting tested in those zip codes.
Well, and that, as Jametta alluded to, we're hoping to help with that. You and I and CHAS are working together to have additional mobile testing available. And the first one will be on the 22nd of December. So folks that are listening, if you want to get tested, need to get tested, please come out. We can drop that information in the chat. I'll ask the moderators to put you and I's address in the chat right now. So please come out to that. And then where are the hot spots statewide? Where are the hot spots in the city? Do you know which activities are most risky for transmission now? You know, I'm not sure if it's changed since, you know, it's winter and, you know.
So definitely with the hotspots, that we're finding a lot, the other counties that are near to us. So Macomb has been a little bit of a hotspot, as well as Oakland, in regards to the southern part of the state of Michigan. And then the map that I had shown earlier, which is available on our website, has the exact zip codes and parts of the city where there are, you know, positive tests coming back. And those would be the hotspots or the areas that I would caution when you go about in those areas. Activities that increase your risk involve activities where you're interacting with people from other households. So we had this Pause to Save Life, which encouraged people to create pods and limit the number of extra people that they are interacting with. So these kinds of activities that make you interact with somebody that you're not regularly interacting with, who you don't know how they behave in regards to COVID, if they're being safe or not. And then, of course, activities where you're not wearing your mask or you're too close to people and, you know, within 6 feet, as well as not washing your hands as regularly. Any of those things will definitely increase your risk of catching the virus.
Thank you. And you talked a lot about this, and so did Dr. Bryce, but I don't know if either one of you would like to add how you're preparing for the vaccine distribution. And I'm just going to add one thing to that, and how you're preparing to address the misinformation that is out there. For example, the emails that are circulating that there's fetuses, fetus cells in the vaccine, that kind of misinformation.
Well, I think for us at Chaz, especially serving a bilingual population, we're kind of like in the end stages of producing information, correct and honest information, both in English and Spanish. I think that's really important, really to fight some of those things, unfortunately, that you'll see, whether it's email, as you said, or through social media. And I think as we start to run this out, it's just making sure that this is that we're advertising as much as we can to share that information. So whether that's within the center, whether that's on our social media as well, or if it's just sharing it with all of our patients and within the community. I know this is going to be a challenge. And then I think we're still in the phase of, as I said, if everything goes through, we're going to start to be able to provide vaccines for healthcare workers, and then working with other FQHCs in the region, and then trying to figure out what is going to be the next step for us in terms of when we can have the patient rollout. But I promise as soon as we know, we will be informing everyone, especially everyone on this farm as well.
And to add to Dr. Bryce, the health department, our team, as well as our behavioral health team, which we work closely together, plan on addressing misconceptions, myths about this vaccine on a level of education. So we are available to educate anyone that is willing to hear about it so that they can know how to make the best decisions for themselves, as well as for their families. And going forward, they can have a better understanding of what is going on. And like Dr. Bryce said, we'll give everybody information as we learn more from, the state itself.
Great. Jametta's leaning forward, which means our time is up. There's one other question that if you guys could address offline. It's about, is it true that people who have severe allergies will not be able to get the vaccine because they'll have an allergic reaction or go into shock because of it? So if you could answer that offline, that would be great. And I am going to give it back to Jametta. Thank you.
Thank you. Yeah, that really was a really great question. So please put the answer to that. And we do want to say to all of our families and our audience out there is consistently go to your CDC site, go to the Detroit Health Department site, Wayne County Health Department site, and really so important, talk to your primary care physician to get more information. So go to the people who really got the great information. And speaking about going to people who have great information that our families need, we're really always delighted to have Rajeshri Bhatia to join us to talk about what's going on with our charter schools, who, just like the Detroit Public School Community District, are trying to assure that children are healthy and being educated in the really trying times that we find ourselves in and the impact of COVID. Rajeshri, please join us.
All right, thank you so much. Good afternoon, everyone. It's been a great town hall with some really wonderful information. So thank you to all of my fellow speakers as well for sharing your expertise. As Jametta said, the charter schools are responding to student and parent need and the local health context in the same way that every other district in the state is. We have seen a number of schools decide to move to a virtual delivery through the rest of the year based on health conditions and feedback from the parents and families and teachers within their schools. We also have several schools that took maybe a break of a week after Thanksgiving and then have resumed in-person learning for the remainder of the year as well. One of the important things to remember, and I've mentioned this before, but it bears mentioning again, is that each charter school is independently governed by its own board. So that means that each board makes its own decision about how to continue to deliver instruction using data. Some of it is common. So if we look at the health data, any school in the area is going to be looking at the same health data that's put out. But then there's also parent feedback, student engagement, and teacher data that will vary from building to building. And so that's kind of how boards are making decisions. There have been a couple of cases recently in which parent feedback, when a board was considering going in one direction, but the parent and teacher feedback was very strong in the other direction. And so the board decided to, go with what the feedback said. And it happened both ways. A school that was considering going virtual went to an in-person based on that feedback, and a school that was going to return to in-person went to virtual using that feedback. So it's not a, it's interesting that depending on what environment we're in and what the what the families themselves are experiencing, their feedback and preferences are different. But I will encourage every parent to attend those board meetings. They are virtual. They are always posted on the school website at least 24 hours in advance, and there's a link. You are always most welcome. There is time on every agenda for anyone who's attending to make a comment. So I encourage you to go in and have your feedback heard. They are listening. They are very much listening. But we're struggling and facing the same issues as everyone else. We want our kids to be healthy. We want them to be educated, and we don't really want to have to choose between the two. So we're trying to find ways to get both done. And your feedback and engagement and participation is what helps us do that.
So do we have Christine? Thank you, Rajeshri. And you have this marvelous way of being so succinct with it. Cindy, do we have any additional questions for Rajeshri?
Yes, absolutely. Thank you so much for being on, Rajeshri. As you know, I'm a mother of 3, and I've worked with you in the past, and I've told you about my struggles parenting right now during COVID and trying to figure out just, how do I help my children? I have 3 children, a high school, middle school, and a preschooler, and each one of those approaches is different, right? It feels like some of us parents are stuck in figuring out, how do we support them? How do we communicate with teachers? So I did brainstorm a couple questions for you. Just to start us off, I think the first question was really if you can talk a little bit about your plans post-holiday, because I don't know about you, but in my household, we've kind of been, the holiday has been our marker where it's like, all right, let's just make it to the holiday, right? But post-holiday, all of it just feels like a blur. So if you can talk a little bit about your plans post-holiday.
Okay, great. And do you want me to talk about schools or me personally? Because I'm right there with you in terms of
we're all in this, right?
Yeah. So as far as the schools go, there are some schools that have already determined that they are going to delay on in-person education for a week or 2 post-holiday. That is to essentially allow for whatever happens over the holiday to run its course, and we can then look at health data and determine when is it safe to return to school. There are others who are very much planning to stay their course. And when I say that, I mean, if they're virtual, they're going to remain virtual. If they're in person, they're going to go back to in person after the holidays. There is a concerted effort being made by every school, asking folks, much like we've said on this call and we've heard elsewhere, that to really use restraint during the holidays and be safe. If possible, avoid gatherings. If you're going to be in gatherings, do so in a safe environment, wear masks, practice social distancing, etc. And some of this is we have plans, but we also recognize that if data, particularly health data or feedback, really tell us that we need to change those plans, that we have to be flexible. And I think that's the key. It's hard. It makes it really difficult to plan, but we also realize that we can only plan for so much time in advance, and we still have to be ready to be nimble when needed. The break is also going to be a time, I think, for people to get that literal break from this. This has been hard. We've been doing this since March, excuse me. And while the summer was a break, it was also the anxiety of what was going to happen this fall was also on our mind. So it wouldn't really feel like a true break. So this is a time that families and students and teachers and everyone really should use this time to disconnect and regroup and start the new year with as much energy and positivity as possible, because this, we're hoping that the vaccine and we're hoping that these other measures are going to make 2021 more manageable. And certainly it'll be more manageable than 2020, because 2022 just took us by surprise. That said, it's still important that we all kind of enter into it knowing that, the only constant is going to be change. And it is likely that we're going to be in this state that we're in right now for at least a month or 2, just based on patterns that we've seen in the past. And so this is really probably the first time everyone can kind of just take a breath, turn off the computers, turn off the screens, Don't worry about multiplication. Read a bit every day if you can, but as a math teacher, it pains me to say don't worry about math, but let's not worry about math unless it comes up in real life. And you know, really kind of think about it. But as far as schools go, that's the game plan. They're having their December board meetings, they're making their decisions for January, but they also recognize that if data tells us that what our plans are not possible, that we have to be ready to make changes.
Thank you. That was very helpful. Are the authorizers recommending any changes to curriculum? Anything that you can share about curriculum, grades, parent communication?
Sure. So the authorizers don't really make any recommendations. Our role is really to ensure that schools are following the rules that are set forth. What I'm hearing though from schools and just kind of in the sort of education circle as a whole is we're really trying to take a look at, you know, what makes sense, you know, given the parameters that we have, given the engagement that we have. How do we present instruction and curriculum in a manner that makes sense to kids that might be different in the virtual sense than than it is in an in-person? And we also have to take into account the sort of stress that kids are under, regardless of where they're educated. Even if they're in the same classroom they were in February of last year, the circumstances are so different that the mental health of children and of teachers is something that schools and organizations are taking very seriously. So even though it's not in our role to be engaged in that kind of work, we are supporting our schools and finding the right kind of resources to support folks in that sort of in the more social emotional realm, so that the academics can actually have a place to land. I mean, you could have the best lesson, you could have the best, you know, resources, but if a student isn't mentally or emotionally ready to receive it, it doesn't have really any value. So we recognize that we have to sort of really take a look at, you know, the Maslow's needs, if you will, before we can get to Bloom's taxonomy of learning. So that would be where I'd say we're really talking to schools about paying attention to that and encouraging them to continue to listen to their teachers, which they have been, because the teachers have a really good insight into that in terms of students and for themselves.
Thank you. That's very refreshing to hear that those recommendations, those communications are being held. Now, I know the last time we received an update, well, a few times, the schools were having a hard time connecting with students. Do you have any updates on how many students you still have to connect with and what kind of support you may need from community to help our students?
Sure. You know, and again, I can only answer for a limited number of schools because that's what I have guidance, you know, what I have access to. The trends amongst the schools that I work with and that we work with are very similar. So I'm going to extrapolate them to the entire community, but I also recognize that there might be an example here or there that is different. So what we're seeing is that the majority of students and families have been reached. We don't really have a lot of kids that are just not, we don't know where they are, or we were expecting them, I should say, and we don't know where they are. You know, and tactics, everything from, you know, phone calls to home visits have happened. And even in the world of COVID, you know, you still have principals or school administrators getting in the car and mask on, you know, 6 feet from the door, knocking on there just to check on how folks are doing. You know, we're hearing that that connectivity and access is an issue. Granted, I think it's gotten better based on, you know, community sort of resources that have become available, and just has been a focus for all of us to help that to that end. So that's been an issue. And I think there's also this feeling of being overwhelmed. Sometimes kids don't log in or engage because they may not have supervision, or they may have, you know, the parent might just not be ready to do it that day. And as a mom of a 5-year-old who's doing virtual school, I know that feeling. I mean, that dread of like, oh gosh, here we go. She doesn't have her homework done, or she's not ready, and maybe we just won't log in. And so that's a very real feeling, and we recognize that. So I believe that schools and teachers are trying to do whatever they can to reassure families that it's okay, log in even if you don't have things done. Like, we would rather see you and engage with you and than to not see you or have you at all. You know, so I think that as far as student engagement, the numbers are very promising, but I also think that that's something that we recognize that it doesn't, just because we reach it this week, if we don't have that same effort, we may not reach it next week. So it's a concerted effort. I think the area where we can all see some improvement, or where we all like to see some improvement, is in the parent engagement in terms of the feedback. So many of the schools are hosting town halls, they're doing surveys, they're hosting conferences. They're trying to do what makes sense for their communities, and they are getting parents to engage, but the percentages are still lower than we'd like to see. And the purpose of getting parent engagement is not just to have high numbers, but it's really how we get the feedback. And so if 30% of parents log in from a particular school, and that those are only families that give feedback, that's kind of all the school has to go by. And so sometimes it's great and it reflects the community, but sometimes it may not. And so we recognize that as well, and we're trying to figure out better ways to get to make parent feedback and parent engagement more accessible as well. But as far as students go, I think that it's a concerted effort. Obviously, we would like to see until it's 100%, just like on any given school day, we want to see 100% of our students in the seats. Until it's 100%, we're not fully satisfied. But I do believe that schools have gone and found different ways to engage different partners, even community partners and others, to find ways to reach the students who they were not able to reach.
Thank you for that. So my next question and final question is, are you projecting any deficits for the 2021 budget?
That is a hard question for me to answer. I wish I knew that. That is very difficult for me to answer. It's kind of out of the realm of my work. But we hope not. We hope to see the state and others come through the way that they have this year for schools. We were expecting major cuts and deficits this year, and we found a way to not have that impact on students. So I'm hoping that continues, and we recognize that investing in students is one of the best ways for us to move forward, and so that we don't see that.
Thank you, Rajeshri. Is there anything else you would like to share with families to maybe weather this holiday period or anything else?
Hang in there. We're all experiencing it. We all feel it. You're not alone, even when it feels like you are. And I have one child in school and a newborn, but one child, and it's super overwhelming when I hear Cindy talk about having 3 kids, 3 different stages. I get tired just hearing about it. It's hard. This is hard. This is hard for all of us. But the way we get through this is getting through it together. The way we get on the other side of this is doing what we can to manage and mitigate through this and get to a point where things can be safe and in person, and we can use this as a learning experience to say, here's what worked better perhaps in this area, and here's what we're going to do differently when we get back in schools. But it's hard for everybody, but this is a great opportunity, this 2-week break, to really just regroup and restore ourselves, whether we're parents or students, and make sure that your kids are getting that opportunity as well.
Thank you so much. Christine, any other questions from the public?
No, Rajeshri does such a wonderful job that I think she answers all the questions so well. So no, there's not any questions at this time, but thank you for always sharing really important information. And so, instead of having, Jametta, should I kick it back to you?
I think.
Or are we ready to close out?
Yeah, I think we're just about ready to close out. But what I would love to do is I do want to just let the audience know that something really special happened last Saturday. And so I'm really pleased with Detroit Parent Network. For over a decade, we have always identified community champions, parents and partners who are positively affecting families throughout the city of Detroit. And at our annual meeting last Saturday, the coalition was identified as our citywide champion for parents and youth. And so I have almost no words to say about how excited we were to be able to bestow this recognition on the work that we do, because it's this coalition and all of you out there and all the organizations that have made a difference to help our families know that they can get information, love, and support throughout this pandemic. We're only just a click of a phone, click of the email, click of the computer to connect each other. So congratulations to all of my monumental, committed, and awesome partners in this work. Thanks.
Thank you so much, Jametta. This is such an honor. I'll speak for the group. Such an honor because this has really, I think, been, I don't actually want to call it a labor of love. I think it's been just a pure joy to be able to do this together and to learn together. You know, as we've done these town halls, you know, I'd love to say that this is just for the folks that are watching right now, but to be honest, I think is so valuable to all of us.
Yes, yeah.
And I think I'm so excited about what we all do together in this space, but in other spaces for the years to come. So not all things have been difficult in COVID. This is some of the sweetness I feel like that has come out of it. So, okay, we're going to wrap up, everyone. It has been a really powerful town hall today. We want to thank all of our experts that have come to talk with us, and we want to thank each of you for joining us. Again, if your questions were not answered, we will get the answers and we will post them next week on onedetroitpbs.org and on DPTV's Facebook page. If you'd like to have regular updates, or if you want to hear from a certain expert that we haven't brought on yet, or you'd like us to bring someone back, or you have a topic that you want us to talk about, please put that information in the chat right now, or you can text us at 313-288-2082. Again, that number is 313-288-2082. And we always have a few things that we either ask of you or want to let you know. The first is that Urban Neighborhood Initiatives has an outdoor classroom. We just launched it. It's really beautiful. Our young people actually painted murals on the street. We close off the streets during the day, and there are activities going on. So if you're feeling like you want a little socialization outside of the people that have been in your little bubble, and you want to do it in a safe way, please come see us. We have hand sanitizer and masks and fresh air, and our staff has planned a lot of really wonderful things. It's on Mullane, and our address is 8300 Longworth. So we'd love to have you come out. And then also, if you want to get tested for COVID, please come out and see us on December 22nd. If you're planning on seeing family, or you want to know, the testing is free. You do not need an ID. You do not need insurance. You just come to the mobile site and get tested. Again, that's December 22nd. We will make sure that we get all of the additional details to you next week, but put it on your calendar. And like always, we would love for everybody that has been a part of this town hall to turn on their cameras, because it truly is a group effort. And we want to remind everybody to stay healthy, stay powerful, and stay strong. Cindy, can you please say that in Spanish?
Manténganse saludables, manténganse poderosos y manténganse fuertes.
Okay. Everyone, take care.
Bye, everyone.